Hello, this is Belay, orthopedic surgeon with OrthoVirginia, specializing in joint replacement surgery. Today, I thought I would go over some of the models that we look at for hips and knees to understand what it is to have osteoarthritis. This model here has a blue surface, which is the normal cartilage in the knee. It acts to lubricate and protect the knee as you walk and run. Over time, you can have injuries to this cartilage surface, and it looks like small divots or cracks in the cartilage. Over time, this can progress and cause inflammation, swelling, pain, and trouble sleeping at night. Several non-operative interventions like injections, anti-inflammatory medications, and therapy may stop working to control your symptoms. At that point, one option is knee replacement surgery. And what that looks like is replacing the worn away cartilage with a smooth metallic surface and a plastic insert that acts to create a smooth gliding surface to recreate the normal knee anatomy.